My name is Eoin Feeney. I'm a consultant in infectious diseases at St. Vincent's University Hospital here in Dublin. I'm a past pupil of Belvedere. I graduated in 1996 before going on to study medicine at Trinity College Dublin and subsequently undertake my training in infectious diseases here in Ireland and spending a couple of years in Boston before coming back in 2014 and setting up the ID department at St. Vincent's. I currently live in Clontarf with my wife, who's also a doctor, and my 3 daughters. So the question is, what are the key aspects of my role with regards to the COVID-19 response in Ireland? So my role is predominantly based at St. Vincent's. I'm involved in I suppose, first of all, the day-to-day bread and butter stuff, the management of patients who are presenting with suspected or proven COVID-19. I'm involved in their assessment and diagnosis and involved in their treatment when they are confirmed to have COVID-19. We also continue to see many patients with infection and respiratory related problems just because of the nature of the assessments we have to provide. Beyond that, we are also involved in the follow-up of our patients with COVID-19, running infectious diseases clinics and follow-up clinics for individuals who have been discharged. There's another level, I suppose, the strategic and operational level I'm heavily involved with in planning the hospital's response to the pandemic. So right from the start, we have been making plans that are, how we would assess 1, 2, 5, 10 patients presenting with possible COVID-19, but we've had to obviously significantly upscale that over the past few months. And I have been involved in the plans for upscaling the number of wards we've used, where we're going to manage patients, what staff we're going to use, how we're going to test staff who become unwell, and how we integrate with other very important specialties such as, for example, respiratory medicine, clinical microbiology, critical care medicine, and the emergency department in St. Vincent's. And at the height of the pandemic, we were meeting twice a day to discuss the hospital's response and what the dynamic changes were. That's pretty much down to once a week now. Currently, we're really in the process of trying to unpick what we've done, but maintain a certain level of readiness to diagnose any more cases of COVID-19. Thankfully, we haven't seen a new case in a few weeks at St. Vincent's Hospital. Finally, I suppose my other role was really giving advice to practices and services that were within our catchment area, but actually outside the hospital. So I was giving advice to general practitioners, and one thing we did a lot of, which I thought worked very well, was that myself and other infectious disease doctors, along with the emergency medicine physicians and the local geriatricians, went out to nursing homes who were obviously very badly affected by the pandemic, and we provided direct advice to them, how to structure their facilities, how to structure their buildings, how to use their staff, how to use PPE, infection control practices, and I think they found this very helpful at a time when they were having significant problems with the pandemic. So what is the most encouraging thing for me about the way that Ireland has handled the pandemic to date? The most encouraging thing, I would think, is the way the country quite rapidly realised that we were facing a problem which we had never faced before. The health service comes under a lot of criticism, and I would be in agreement with a lot of that criticism. But almost immediately, the health service took the steps that were required to start making changes to deal with this unknown virus that was arriving and that was beginning to spread in our community. The changes that were made within the hospitals and the changes that were made in working practices, everyone really pulled together, everyone cross-covered, and everyone worked alongside their colleagues to ensure that we were able and ready to cope with this. However, I think that the biggest change was done by the people at large, by the general public. This virus was not stopped by hospitals, it was not stopped by the health service, it was stopped by individuals staying at home, complying with the physical distancing recommendations, protecting their friends, protecting their vulnerable family members. And because of that, those of us working in hospitals were not overwhelmed and we're not swamped. And I think we can be proud of that as a country. So the question is what advice I would give people who are either considering studying medicine or are currently studying it, maybe at third level or at graduate level. I think medicine is a fantastic career. It's clearly hard work, as many professional careers are. I would uh, like to remind people of the breadth and the variation in medicine. A lot of people only think of surgeons or doctors or GPs, maybe, but I have classmates working for Médecins Sans Frontières, global health, working in pharmaceuticals or academia, or even in the legal and regulatory side of medicine. So I think medicine is a good general career, which is not often thought of. I think if you are interested in if you want to do medicine, you've got to think about why you want to do it. And I think if you're interested in a career which is constantly changing, which is hard work, which gets you to interact with a load of different people, but also is a good marriage between science and personal interaction, then it could be the career for you. So the question is, what advice would I give to Belvedere College students and families with regards to how they can best balance caution with social interaction in the coming weeks? I think the key message really is to continue to follow public health advice. This is a virus of large indoor gatherings and crowds, so we should avoid those. I think if you are using public transport or are in areas where you can't physically distance, you should be wearing face coverings and maintaining a meticulous hand hygiene. If you're unwell, you should be staying at home and contacting your GP for advice. And I think we should be watching public health reports. I think if we begin to see a significant amount of cases associated with any particular activity, we should be changing our behaviour appropriately and being very cautious around those of our family and friends who may be either medically vulnerable or in a particular at-risk group. I think we have to consider foreign travel very carefully. If as airports and travel open again, I think we need to watch what is going on in other jurisdictions and in other countries, and we may need to consider limiting or cancelling trips that maybe we've been looking forward to. But if there is significant ongoing transmission in particular areas, it would not be wise to travel there. So the question is, what advice I give to the Belvedere College community regards how to best prepare for winter this year and how to do our part to alleviate the pressure on the health service. I think I'm concerned about winter this year. I'm concerned about winter every year, but this year we'll have the novel coronavirus with us in Ireland for the first time. Our health service has been changed substantially and is operating under significantly reduced capacity due to the constraints around infection control practices for COVID-19. So what has always been a very difficult time for us is likely to be more difficult. It is likely we will get influenza circulating. It is likely we will also get a increase in circulation of COVID-19 as people begin to congregate closer together and people that are able to go outdoors less as the weather gets colder. So my recommendations really would be in how we can mitigate or prevent that. I am a strong believer in influenza vaccination, and I think this winter there will be a push for widespread influenza vaccination, and I would recommend as many people as possible to take it up. Flu vaccines are not perfect vaccines insofar as the protection they don't give is perfect, but they definitely lead to a reduction in morbidity and hospitalizations. And the last thing we want to be doing is seeing more people with flu presenting to hospitals and to be putting more pressure on the health service. I think the same messages go across if you're unwell. You should stay at home. I think you should be protecting your vulnerable family and friends. I think those, maybe for example, for the school students, those who are doing the junior cert or leaving cert, there is a good chance we may need to go back into some kind of partial lockdown at some stage over the winter. I think people need to be ready for that. I have three young girls myself, and I am fully hoping that the schools are open as normal in September, but it would not surprise me if at some stage over the coming months some kind of lockdown or shutdown happens. And I think people need to be prepared to do this blended learning or this virtual learning that's been done previously. Don't get me wrong, I don't think it's in any way as good as attending a school, but it is something that people need to be ready for. So I think being vigilant, maintaining and following public health advice, and influenza vaccination would be my key messages. So I was asked one memory or memories of Belvedere that I think has helped me as a doctor or helped me going forward. I think one thing that stood to me and has stood to a lot of people over the last few months is I think in Belvedere we were always taught not to believe things just because they were written down, and not to take things as granted, but to question why things are the way they are, and why things should be done in a particular manner. And particularly in the setting of a novel pandemic, when we are literally learning on our feet, that was very helpful because we have changed our practices. What we do now is very different from what we did in February or March. And I think having been instilled with that questioning ability really stood to me, and is something I think has stood to me throughout my career, and hopefully will continue to do so.